Chronic kidney disease is a serious medical condition that not only threatens kidney function, but may also threaten your very life. Chronic kidney disease is characterized by a progressive deterioration of your kidney's ability to filter wastes, toxins, and excess fluid from your bloodstream. Symptoms of chronic kidney disease often don't appear until the condition has reached an advanced stage in which kidney function has become greatly impaired and the risk of kidney failure is high. There are a lot of possible causes. Some are related to other kidney problems, including kidney stones, kidney infections, kidney cancer, or a condition known as polycystic kidney disease, or PKD. But chronic kidney disease can also be caused by other health disorders. Diabetes type 1 and type 2 and high blood pressure or hypertension are two of the more prominent. Others include bladder cancer, lupus, and enlarged prostate. In addition, you're considered to be at higher risk for CKD if you are a member of the African American, American Indian, or Asian American races, are grossly overweight, are more than 65 years old, have a genetic predisposition for kidney problems, CKD often runs in families, have cholesterol levels that are higher than normal, have heart problems, use tobacco products. Besides impairing kidney function, chronic kidney disease can also lead to a variety of other medical conditions. These include anemia, a weakened immune system, bone weakness, edema, and even impotence. When chronic kidney disease reaches a stage in which the kidneys stop working, known as end-stage kidney disease or ESKD, reversing kidney disease is impossible. You are considered to have end-stage kidney disease when you've lost 85% of normal kidney function. The only options left for staying alive at this stage are kidney dialysis or a kidney transplant. Therefore, early detection is critical, as it is with so many other diseases. With early detection, the progress of kidney failure can be slowed. Symptoms can be minimized and you can lower the risk of complications. The key to success is diagnosing and treating the underlying cause. Nonetheless, kidney function sometimes continues to deteriorate despite treatment. The National Kidney Foundation has a program called Kidney Early Evaluation Program. It offers free screening for anyone in a high-risk group. Those who are eligible include individuals 18 or older with high blood pressure, diabetes, or a family history of kidney disease. Several simple tests are used to diagnose kidney function. Once a cause has been determined, your doctor or medical team will consider treatment options. If you have high blood pressure, your doctor may prescribe medications to bring it down. He or she may also recommend drugs for lowering cholesterol if your levels are above normal. Medications for anemia, weakened bones, and swelling may be appropriate in certain cases. A diet for people with kidney problems is now available. This diet focuses on keeping a balance of sodium, potassium, phosphorus, protein, and fluids to maintain healthy kidneys. Chronic kidney disease symptoms often develop over long periods of time. In fact, symptoms may take years or even decades to appear after the kidney problem itself begins. Your kidneys can continue to function with no noticeable deterioration even though more than half of your healthy kidney tissue has been destroyed. There can be even greater damage bordering on kidney failure before CKD symptoms begin to appear. However, when they do begin to appear, they're likely to include one or more, usually more, of the following. You'll notice a decrease in urine output. There could be times when you feel the need to urinate, but nothing comes out. When you are able to urinate, you may notice the presence of blood in the urine stream. Nausea and vomiting are typical in cases where there are kidney problems. A reduced desire to eat is typical. You may also begin to feel extremely tired and weak, and memory lapses occur, and it becomes more difficult to concentrate. Normal sleeping patterns will be disrupted. Muscle twitches and cramps are also common chronic kidney disease symptoms. There may be some skin problems. Kidney disease itching is common. This may be caused by a condition known as vasculitis, a visible rash which triggers swelling of blood vessels under the skin. Swelling of the feet and ankles, known as edema, is another sign of chronic kidney disease. This occurs because your kidneys are not filtering fluids, wastes, and toxins from your bloodstream as they normally would. These fluids build up, especially in the area of the feet. There are also a number of non-specific chronic kidney disease symptoms. These are symptoms that are common to a variety of other disorders. There are several ways of diagnosing kidney disease, including kidney function tests. These can be especially helpful if you belong to one of the high-risk groups that statistically are more likely to get chronic kidney disease. Type 1 and type 2 diabetes are especially hard on the kidneys. High blood pressure or hypertension makes the heart work harder and forces blood through the kidneys at higher pressure. This tends to damage the tiny blood vessels that help filter out fluids. Heart disease decreases the efficiency of circulation throughout the body. Poor blood circulation means poor filtration of the blood by the kidneys. High cholesterol causes plaque to build up in the blood vessels, again reducing efficient blood flow and making it harder for the kidneys to perform their functions. Those who smoke tobacco products or are obese are also at greater risk for developing chronic kidney disease symptoms. Finally, if you're an African American, American Indian, or Asian American, you are more likely to develop chronic kidney disease. And anyone who has a family history of kidney disease or is 65 or older is also in a higher risk group. Chronic kidney disease, or CKD, is especially dangerous because it slowly destroys the kidneys. By the time CKD symptoms appear, significant and irreversible damage has usually been done. Once kidney failure has occurred, there are only two options for survival: a kidney transplant or kidney dialysis. Chronic kidney disease stages define the progression of a serious and potentially life-threatening kidney problem. Chronic kidney disease, or CKD. Chronic kidney disease stages range from stage 1 to stage 5. The higher the number of the stage, the greater the progression of the disease. Chronic kidney disease is a progressive condition that develops over an extended period of time. It can be decades before symptoms begin to present themselves. By the time symptoms are noticeable, a large percentage of kidney tissue may have been destroyed. There are many possible reasons behind such damage. Chronic kidney disease stages are useful diagnostic tools for doctors who can treat their patients based on the stage their kidney disease has reached. Doctors use a measurement called the GFR to determine how efficiently your kidneys are functioning. GFR is an important factor in determining chronic kidney disease stages. Stage 1. Damage at this stage is regarded as mild. A GFR of 90 to 100 is typical. At stage 1, you won't even know there's a problem, and it's likely there will be no symptoms. At stage 2, filtration rate is lower, ranging from approximately 60 to 89. You probably still won't have any symptoms, but kidney function tests would begin to detect abnormal protein levels in the urine. Now, admittedly, most people don't pay much attention to the texture of their urine, but when there's more protein than normal, it will sometimes look foamy, and foamy urine is a good reason to talk to your doctor. Stage 3. When chronic kidney disease has reached this stage, you may notice changes in the pattern of urination. You may find you have to get up at night more often, and a certain level of fatigue and weakness may begin to appear. Some occasional cramping, dry skin, and generalized itchiness may occur. Tests might show that you have anemia. A GFR test will give you a reading between 30 and 59 at stage 3. Stage 4. Fluids begin to accumulate because chronic kidney disease has lowered the ability of the kidneys to perform their normal filtering functions. Symptoms may become more numerous and prominent. At stage 4, you need the help of a nutritionist with your diet, limiting your phosphorus, potassium, and sodium. Urinary output will decrease and you'll feel generally unwell. At stage 4, your doctor would start to talk to you about the possibility of kidney dialysis. GFR would read between 15 and 29. Kidney function, by this time, has been seriously compromised. Stage 5. This stage is critical, and kidney failure is imminent if it hasn't already occurred. Symptoms of chronic kidney disease are obvious and may include nausea, vomiting, noticeable swelling and bloating, and almost no urine production. At stage 5, the kidneys have basically stopped working, and patients would either need kidney dialysis or a kidney transplant just to survive. Chronic kidney disease is often discovered by accident because your doctor is treating you for some other